Now moving on, Acting Director at the Center for Respiratory Disease Research at the Kenya Medical Research Institute, Dr. Jane Ong'ang'o, is calling for mandatory screening for tuberculosis in all public health institutions. Dr. Ong'ang'o says KEMRI has doubled efforts on clinical trials for new TB vaccines for both adults and children. Let's take a look.
It is World Tuberculosis Day, and a team of researchers at the Kenya Medical Research Institute, KEMRI, is working on a BCG recombinant phase 3 vaccines trial for infants in Nairobi and Siaya counties. 1,500 participants have been recruited for the vaccine candidate from the Serum Institute of India. If adopted by the World Health Organization, it will be used in the protection against tuberculosis and contribute towards the envisaged universal health care. The acting director at the Center for Respiratory Disease Research at KEMRI, Dr. Jane Ong'ang'o, says screening for tuberculosis for anybody presenting a cough in public hospitals will help to reduce the spread of the disease.
To avoid missing out on TB diagnosis, they need to screen everybody who has cough of any duration. Previously, they used to just screen people who have cough of at least 2 weeks. But we informed them through our National TB Prevalence Survey that they need to screen anybody who presents with cough.
Tuberculosis is a major killer disease responsible for at least 6% of all deaths in the country. Dr. Ong'ang'o says KEMRI has made strides in TB treatment, reducing the treatment period from 18 months to 6 months.
Our target for tuberculosis is to make treatment much easier for the patients who have it.
A senior principal scientist at KEMRI, Dr. Fidelis Nduba, says the use of an app installed on a phone will also be useful in diagnosing tuberculosis.
We install an app on a Samsung phone. A patient would walk into a doctor's clinic, the patient would cough, and the doctor would be able to tell whether that is TB.
Judith Akolo, Lunchtime News.